Hello, vibrant middle-aged friends. Today we have a really important topic prepared.
Yes, David. Today we're going to learn about 5 foods that people aged 40 to 60 must absolutely avoid with scientific evidence. It's said that just avoiding these can dramatically change your health, so I'm really excited.
That's right. As we reach middle age, many things change from when we were young. Even eating just a little bit wrong makes our bodies feel heavy, we gain weight, and we worry about health checkup results, right?
Yes, this isn't simply because we're getting older, but because our bodies are changing. Just avoiding the 5 foods we'll discuss today can greatly change your health.
Then let's learn about them one by one in detail. What's the first food we should avoid?
The first is processed meat. I'm talking about hams, sausages, bacon, hot dogs, etc. The WHO classified these as Group 1 carcinogens in 2015. They're that dangerous.
Group 1 carcinogens? That's really serious. What specific risks are there?
Especially for people aged 40 to 60, when colorectal cancer rates surge, eating just 50 grams of processed meat daily increases colorectal cancer risk by 18%. 50 grams is about the size of one sausage.
Why are processed meats so dangerous?
Processed meats are dangerous because of preservatives like nitrites and nitrates. These convert to nitrites in the stomach, creating carcinogenic nitrosamines.
Then what foods should we eat instead?
Instead, eat fish, chicken breast, and legumes, especially fish. Eating it 2 to 3 times a week gives you omega-3 fatty acids too, so it's a win-win.
What's the second food we should avoid?
The second is trans fats. I'm talking about trans fats in margarine, shortening, and fried foods. The FDA banned their use starting in 2018. They're that dangerous.
The FDA banned their use? That's really dangerous fat. What specific risks are there?
Just a 1% increase in trans fats increases heart disease risk by 23%. For people in their 40s and beyond, when cardiovascular disease risk surges, this is a really dangerous figure.
What specific effects do trans fats have on the heart?
Trans fats increase bad cholesterol, LDL, and decrease good cholesterol, HDL, greatly harming blood vessel health. They also cause inflammation, promoting atherosclerosis.
Then what fats should we eat instead?
Instead, eat healthy fats, like olive oil and avocado oil. These are rich in monounsaturated fatty acids, which help blood vessel health.
What's the third food we should avoid?
The third is high-sugar beverages. I'm talking about carbonated drinks, energy drinks, and fruit juices. Just drinking one high-sugar beverage daily increases diabetes risk by 26%.
26% increase. That's really an amazing figure. Is it even more dangerous for middle-aged people?
Yes, especially for middle-aged people, when insulin resistance increases, it's even more dangerous. High-sugar drinks rapidly raise blood sugar and then rapidly drop it, worsening insulin resistance.
What effects do sugary drinks have on weight?
Excessive sugar causes abdominal obesity, and middle-aged people already have decreased basal metabolic rates, making weight management difficult. Sugary drinks are liquid calories with little satiety, so you drink more.
Then what beverages should we drink instead?
Instead, drink water, green tea, and herbal teas. Especially green tea is rich in catechins, so you get antioxidant effects too.
What's the fourth food we should avoid?
The fourth is refined carbohydrates. I'm talking about white bread, white rice, pastries, etc. These have a high glycemic index, rapidly raising and then rapidly dropping blood sugar.
What does having a high glycemic index mean?
Eating refined carbohydrates frequently causes insulin resistance, ultimately increasing metabolic syndrome risk by 2.3 times. Middle-aged people already have decreased basal metabolic rates, making weight management difficult, and refined carbohydrates make this worse.
Do refined carbohydrates also affect inflammation?
Yes, refined carbohydrates cause chronic inflammation. Inflammation promotes aging and is the cause of various diseases.
Then what carbohydrates should we eat instead?
Instead, eat complex carbohydrates like brown rice, whole wheat bread, and sweet potatoes. These are rich in fiber, so blood sugar rises gradually and maintains satiety longer.
What's the last fifth food we should avoid?
The fifth is excess sodium. I'm talking about excess sodium in ramen, instant foods, and processed foods. Excess sodium intake increases hypertension risk by 1.7 times.
1.7 times increase. That's really dangerous. Is it even more serious for middle-aged people?
Yes, for people in their 40s and beyond, when hypertension rates surge, this is a really dangerous figure. Just reducing sodium by 1 gram decreases systolic blood pressure by 2 to 3 millimeters mercury.
Does sodium also affect other health problems?
Yes, excess sodium decreases kidney function and increases calcium excretion, raising osteoporosis risk, especially for middle-aged women. When bone density rapidly decreases after menopause, extra caution is needed.
Then what seasonings should we use instead?
Instead, use natural seasonings, herbs, and spices. Garlic, ginger, red pepper powder, and pepper add flavor without sodium.
Now let's learn about practical methods for avoiding these 5 foods. How should we approach this?
Trying to change everything at once makes it harder to sustain. Gradual approach is important.
What specific methods are there?
First, record your current diet for a week. It's important to accurately understand when, what, and how much you eat.
Then what's the second?
Second, limit one thing at a time. For example, reduce processed meat in the first week, then limit sugary drinks in the second week, approaching gradually.
What's the third method?
Third, prepare substitute foods in advance. Always have fish or chicken breast in the refrigerator instead of processed meat, and always carry water or green tea instead of sugary drinks.
What's the fourth method?
Fourth, practice with family. It's hard to sustain if you try to change alone. Have the whole family change to a healthy diet together.
What effects can we expect from avoiding these 5 foods?
Just avoiding these 5 foods, you can experience the following changes within 3 months. Weight decreases by an average of 3 to 5 kilograms, systolic blood pressure decreases by 5 to 10 millimeters mercury, and fasting blood sugar decreases by 10 to 20 milligrams per deciliter.
Those are really amazing effects. Are there other changes?
Yes, inflammatory markers like CRP decrease by 30 to 50%, greatly improving overall health status. Actually, 50-year-old male Mr. A lost 4 kilograms in weight and his blood pressure returned to normal range after practicing this method for 3 months.
That's really impressive results. Are there other cases?
40-year-old female Miss B returned from prediabetes to normal blood sugar, but there are some precautions.
What precautions are there?
People with chronic diseases should consult a doctor before proceeding, especially people with diabetes, hypertension, or kidney disease need extra caution. Also, gradual change is recommended over sudden change.
Then let's summarize the key points.
Yes. First, gradual change. Don't try to change everything at once, but change one thing at a time, step by step. Second, with family. It's hard to sustain if you try to change alone.
And the third?
Third, prepare substitute foods. Prepare healthy substitute foods in advance. Fourth, consistency is key. Health isn't built overnight, so practice consistently.
This was really useful information. I'll definitely practice avoiding the 5 foods you introduced today.
Yes, create a vibrant middle-aged life with a healthy diet. If you want more health information, please like and subscribe.
Thank you. See you next time.